Keys of occlusion. When we say keys of occlusion, we always think of Andrews' 6 keys of occlusion. But what we are supposed to know is there is something called as Roths keys of occlusion also. But what is the difference between Andrews and Roths? The Andrews 6 keys of occlusion are based on the static occlusion, whereas the Roth gave his 4 keys of occlusion based on the functional occlusion. Now we will know about Andrews' 6 keys of static occlusion. Now key 1 is the molar interarch relationship. The mesiobuccal cusp of the upper first molar rests on the mesiobuccal groove of the lower first molar. Along with that, the distal surface of the distobuccal cusp of upper first molar should occlude with the mesial surface of mesiobuccal cusp of the lower second molar, and the mesiolingual cusp of the upper first molar should occlude in the central fossa of the lower first molar. And the second key, it is the mesio-distal crown angulation, that is tip. The gingival portion of the long axis of each crown should be distal to the incisal portion. It is measured by the inclination of the long axis of the crown to a line perpendicular to the occlusal plane. And this third key, it is labiolingual inclination, that is buccolingual inclination of the long axis of the crown, not to the long axis of the entire tooth. You should remember, not to the long axis of the entire tooth. The lingual crown inclination occurs in the maxillary and mandibular posteriors, that is negative inclination. The labial or positive inclination is seen in the maxillary incisors. It is determined by the resulting angle between a line perpendicular to the occlusal plane and one tangent to the middle of the labial or buccal clinical crown. Fourth key of Andrews is the absence of rotation. There should not be any rotation in normal occlusion. Rotated anterior teeth occupy less space and rotated posteriors occupy more space. Therefore, by derotating the anteriors, we lose space, and by derotating the posteriors, we gain space. Key 5, interproximal contact. The proximal contacts should be tight and there should not be any spacing. Key 6 is the curve of P. The deep curve of P is seen in crowding, flat curve of P is seen in normal occlusion, and reverse curve of P results in spacing. We finished about Andrews keys. Now let us go to Roths key of functional occlusion. The key 1 is coincidence of intercuspal position, ICP, and retruded contact position. This is the key 1. The coincidence of intercuspal position and retruded contact position. Key 2 is maximum and stable cusp to fossa contacts throughout the buccal segments. The cusp to fossa sits like this. So, there should be a maximum contact and it should be stable. Key 3 is disocclusion of the posterior teeth in the mandibular protrusion by even contacts on the incisors. When the incisors contacting, there should be a disocclusion in the posterior teeth. Key 4 is the lateral movements of the mandible are guided by the working side canines, with disocclusion of all the other teeth on both working and non-working sides. That is, the lateral movements of the mandible are guided by the working side canines, with disocclusion of all other teeth on both working and non-working sides. These are the 4 keys of functional occlusion by Roth. When we speak about the keys of occlusion, apart from Roths and Andrews, we need to know about Angle's concepts of normal occlusion, which is based on key of occlusion and line of occlusion. The key of occlusion is angle considered maxillary first permanent molar as the key of occlusion. He said maxillary first permanent molar is the most constant in its position. He related maxillary first permanent molar to key ridge position. Then the mesiobuccal cusp of the first molar rests in the mesiobuccal groove of the mandibular first molar in normal occlusion. This is called as class 1 molar relation. And line of occlusion. There are two lines of occlusion, maxillary and mandibular. The maxillary is a smooth curve passing through the central fossa of upper molars and along the cingulum of upper canines and incisors. The mandibular line of occlusion runs along the buccal cusps of the posteriors and incisal edges of the anteriors. The Angle's concept of normal occlusion is class 1 normal occlusion. Molars are in class 1 relation. The lines of occlusion are intact in both maxillary and mandibular arches, and there should be full complement of teeth present. So, in the keys of occlusion, we studied about Andrews' 6 key of static occlusion, Roths' 4 keys of functional occlusion, and we studied about Angle's key of occlusion, that is first molar, and lines of occlusion. Keep watching these videos on YouTube and please subscribe to my channel for further updates about orthodontics and orthodontic classes.